I think one of the best parts about LSU is we get to work at a level 1 trauma center in one of America's biggest metropolitan cities, New Orleans. And so you pretty much see everything here orthopedic trauma wise over your 5 years here. And really when you're a junior resident here, you have the biggest source of orthopedic knowledge in the middle of the night. You're the orthopedic resident. You're responsible for the bones, the ligaments, the cartilage, the joints. So that's all on you. And of course you have senior support at home and your attendings as well. But you really feel that responsibility here. And I think that having that responsibility is a good thing because it helps set the foundation for you as a surgeon. It helps you realize that this is what you're going to do in the future, and it gives you that confidence as you move forward in your career.
You start that trauma internship at university really scared, thinking, I don't know if I'm going to be able to do this, but then you think everyone before me's done it, so I know that I can. And then you come out realizing, okay, I know how to treat so many things now. I know how to treat people with a fracture on every extremity. I know how to treat complex spine trauma. I know how to treat an ICU patient with orthopedic problems. It's easy to formulate a plan when it's just an ankle fracture. Okay, I'm gonna fix this ankle. But when they have 4 or 5 fractures that need an orthopedic surgery and they're critically ill and they have to go get X-lapped with general surgery, or they have a vascular injury, you have to be able to put all the pieces together and not just think about only your orthopedic surgery. And I think university really trains you to kind of see the whole picture and think about where you fit.
You know, you see firsthand the inner workings of like academic medicine and, you know, taking care of patients at a big level 1 trauma center, especially with the volume that we have here, whether it's car accidents, you know, whether it's industrial injuries, you know, alligator bites, gunshot wounds. And so I think when you see all those things and get exposed to those things here, you know, I can't imagine like walking into the ER somewhere and being intimidated by something anymore.
It's a great opportunity to first learn how to be a doctor. We're coming straight into residency and we're expected to know all these things and know how to manage a hospital system and interact with other services. And UMC is a great place to do that. Things will come through the door that most orthopedic residencies do not get to see. The amount of penetrating traumas we get, the amount of ATV boating accidents that we see, it's a lot. Some of these patients are the sickest of the sick. They're getting transferred from all around the state to be cared by our teams. So if you can care for the patients at UMC, you can care for any patient.
On average at UMC, our trauma list we can see up to 40 patients on that list. And so that's orthopedic trauma patients who have bony injuries. That could be penetrating trauma. We still see a lot of blunt trauma too. We see both of them. We have a very good balance here between the penetrating and blunt trauma. We also see a lot of periarticular trauma, and I think that's very important to see because long bone fractures are everywhere, but learning how to really do periarticular trauma is important.
So the most interesting case that I've treated at UMC was probably actually a case I did recently with Dr. Cable, who is our orthopedic oncologist. We had a patient who is in her 80s and she had chondrosarcoma of her left humerus. This is a type of cancer that really isn't responsive to radiation or chemotherapy, and so our ultimate treatment plan was going to be to resect the tumor, including some normal appearing bone too, and do a proximal humerus replacement, which turned out great. She's doing well right now. It was some really cool anatomy. Anytime we're doing cases with Dr. Cable, sometimes they are straightforward, but oftentimes he has the most complex things that aren't even written about. Every day is a new adventure, so you never quite know what's going to be unwrapped on that particular day at UMC, but you can guarantee that it's going to be something fun.